Hi, my name is Dr. Sandy Stacy. Welcome to Willow Grace. This is our new hospital that we just opened in December 2020, located in Middletown, Delaware. We just wanted to show you a little bit of the inside of our hospital. When I created this hospital, I wanted to have a very open, welcome, warm feeling. So coming into our reception area, we have the fish tanks, just kind of creating a calm environment. The rock wall behind the reception desk, just creating a very natural feel and welcoming environment. Our waiting room is specifically designed to have a fear-free concept. So we keep the dogs and cats in separate waiting areas. So we have the dog waiting areas where we have the partitions so that they can be separated, and the exclusive cat area so that the cats aren't stressed by dogs walking up to their carriers. Then as we come down the hallway, we have our comfort room. This was a room that I really wanted to include in our hospital design. It has a separate exit for owners that have to say goodbye to their beloved pet. We wanted to be a very comfortable, natural environment, so there's a couch there that makes it more comfortable to be with your beloved pet while you're having to say goodbye. And like I said, having a separate exit so you don't have to go past other people in the waiting room. Our dog exam room, so we have our exam rooms set up separately. So we have specific dog exam rooms so that the scents that are kept in there and the adaptable diffusers trying to reduce the stress that's present for them. A lot of our exams are performed on the floor, so you don't see a stainless steel table in our exam rooms. And we cover the tabletop surface with towels or a grippy surface so that's not slippery for smaller dogs, but the majority of our exams are performed on the floor. We keep the adaptable plug-ins plugged in for the pheromone diffusers trying to reduce their stress going along with the fear-free concept. We also have a separate cat exam room that has feel-away diffusers specific for cats for their pheromone preference. And then we have the cat tree just for them to relax and move around and feel comfortable in the environment, that they're not so much like they're in a veterinary office, and have familiar cat smells rather than smelling a dog. So moving into the back of the hospital, we have the office. I designed this hospital so that it's a fishbowl concept, that I want it to be very centrally located. So my office is located in the center of the hospital so that if my technicians or anyone needs me at any point, I'm easily accessible and I have a view of everything that's going on in the entire treatment area and with any hospitalized animals, with one exception, which we'll get to a little bit later with the isolation unit. But the windows, large windows in the office were very important to me so I could see and be very close to anything that was going on with any of the patients. So this is our dental area. This is where we perform all our dental procedures. We have an x-ray unit that's hanging on the wall because we perform full mouth x-rays of every patient that is undergoing a dental procedure. The wet sink allows us to do the cleaning and allow the water to run down through the sink while we're performing their cleaning. Dental care is very important, and we wanted to make sure we had a specific area where we were able to provide the best care we possibly could for their procedure. Surrounding the dental area, we have our pharmacy where it's just medication storage. And then coming around to our lab area, we have several in-house machines that we're able to perform complete blood work in-house. So performing a complete blood count, chemistry analysis for kidney and liver function, thyroid analysis, as well as complete urine analysis. So looking at any abnormalities that may be present in the urine. And then we have our centrally located treatment table. So this will be where a patient will be prepared for anesthesia, placing IV catheters and any treatments that may need to be administered prior to going into their procedure. Then we have separate dog and cat housing areas. So I wanted to have a separate ward for dogs versus cats, just because with the fear-free concept, I want to make sure our cats are not being stressed by barking dogs. So we have the dog ward that's behind the glass doors, but again, being completely visible. So that's where the glass comes from, so that any patient that's recovering from anesthesia that may be hospitalized or need to stay with us for a short period of time is visible at all times while they're here with us. And the cats in their separate room, we can shut the door so that they don't have the stress of having the barking dogs. We also can keep the feel-away pheromones prevalent in there for them. So this is our surgery room, just where we perform our surgical procedures, keep our specialized equipment in there, monitoring for anesthesia, so our continuous ECG, blood pressure monitoring, pulse oximetry, our anesthesia machine, maintaining a good depth for the patient while they're under anesthesia, making sure that they're safe and comfortable. We perform multiple different procedures from general practice services as well as emergency surgical procedures. So this is our imaging room where we have our X-ray unit that performs digital X-rays. So we would take the X-rays in here and then they would be formed into a digital image that I'm able to visualize on a computer and show to owners. As well, our ultrasound unit stays in here just for storage, and anytime we need an ultrasound, it's mobile so that we can move it around the hospital and take it to even the exam rooms to show owners what's going on the ultrasound. Here we have our isolation unit. Our isolation unit is really not used that often, but it's really for specific patients that may have an infectious disease. So if a patient has an upper respiratory infection or parvovirus that we don't want to spread to our healthy pets, that we would have to keep them in an isolation unit. The ways that we would monitor them while they're housed in this area would be by a baby monitor, so they're not back there without visibility. This is our hydrotherapy room for physical rehabilitation with David Mazzoni. He does laser therapy and hydrotherapy. And this is Gemma on her hydrotherapy session. Thanks so much for watching. We really appreciate you taking this virtual tour with us. We put a lot of thought and effort into making this hospital as fear-free and comfortable and safe for your pet as possible. And we really hope that you'll come visit us soon.